guys, good evening. This is me, I'm Dr. Jayanti. I'm back again with discussion of a new topic, new subject, that is dental histology. Previously I discussed about dental anatomy, so this time it's dental histology. Generally we study this subject in second year as DA-DH, that is dental anatomy and dental histology, but in order to make your understanding easy, I had made the subject divided up into dental anatomy and dental histology. So what is the weightage of this subject? That is, how many questions in our question paper are from this subject. So out of 240 questions, 5 to 7 questions are from dental histology. Dental histology is also known as oral histology. The books to refer from this subject is TenCate's and Orban's oral histology. So students ask how many times we should give to MCQ and theory reading. For theory reading we can give 3 to 5 hours, and 3 to 5 hours, and days, if we count the days, then we can give 4 days. We can also increase it if we feel that we have not yet revised the subject, and the subjects should be studied after completing 12 subjects. So now I come to the important topics which are important for NEET MDS. So the topics are your development and the growth of teeth. In this, your histology, morphology, tooth questions are such as tooth bud is seen at what stage, and your different parts of teeth, that is enamel, dentin, pulp, and ongoing on such different parts. In detail we have to know about enamel, dentin and pulp. So in enamel, your physical properties of enamel, chemical properties of enamel, your hypocalcified stages, amelogenesis. If a student is studying from Orban's oral histology, because it's my personal experience, I had referred to TenCate's. TenCate's is a very nice book, and it gives diagrammatic illustrations and makes the chapter very easy. Now we come to dentin, where the histology of dentin, the histology and mineralization, incremental lines of dentin, and theory of hypersensitivity. This dentin can be studied well from this book also, that is textbook of human histology with color atlas by Dr. Inderbir Singh. So this is also a nice book, you can also refer to it. Then there are also certain theories of hypersensitivity. It is very important, the theories of hypersensitivity. Next we come to pulp. In pulp, your abscess and inflammation, blood and nerve supply of pulp caused by alpha, beta, gamma, delta, which nerves are responsible for causing pain in which type of pulpitis, irreversible, reversible pulpitis, the differences, and location, size, velocity of conduction, zones of pulp stones. Next we come to cementum, the physical properties of cementum, which type of cementum is formed in which parts of tooth, and in which disease the cementum gets hypertrophied and increases in number. Hyperplasia is there, it's also very important. In PDL, periodontal ligament, the important periodontal ligament fibers which are there, the different types of fibers, and we can also refer for periodontium in Carranza's periodontology, where the histological features are very well defined. Next we come to bone, where the composition of lamellar bone, compact bone, cancellous bone is important. In TMJ, temporomandibular joint, the anatomy of TMJ is important, and TMJ is it is a backbone for oral surgery. So in oral surgery biology it is there, and TMJ is very important for MPDS, myofunctional pain dysfunction syndrome. The various types of analgesics given for TMJ disorders, and what type of delivery is generally responsible for TMJ disorders, your forceps delivery, so it's very important, please go through it. Maxillary sinus, again it is there in OS. Then salivary glands, the major glands, mixed glands, serous, mucus predominantly, serous acini, mucus acini, and then your oral mucous membrane, different types of mucous membrane, that is parakeratinized, orthoparakeratinized, your broad retipex or narrow retipex. Histological feature in detail is important. You can't skip a single chapter from dental histology because a diagrammatic question may come from the subject. Then questions from tooth eruption and shedding. In this chapter, your questions may come from teething, which is also an important question in periodontics, and at what age your teething your shedding is done, your calcification of teeth, primary teeth occurs, your formation of root, mechanism by which gabernacular cord is formed, and in miscellaneous there are various structures such as enamel cord, enamel knot, cells in periodontium, which are the different cells, totipotent, pluripotent, which cells are capable to form stem cells, it is important. Then your serous demilunes, what are that, important functions of saliva. Then I have noted out few questions, that is teeth with smallest mesiodistal diameter is your mandibular central incisor, gabernacular cord guides the eruption of which permanent or primary teeth, that is permanent teeth. And oral histology, dental lamina is active up to which age? The answer is 5 years of age. Dental papilla gives rise to what parts, that is dental pulp and dentin. Ectodermal cells in tooth bud, what are the importance? Ectomesenchymal cells. And if there is a difference in any stage, that is either bud stage, cap stage, bell stage, morphodifferentiation stage of tooth bud, what morphological disturbances it is causing, it's very important. So it is an important subject, but combined with dental anatomy, you have to study not in a separate way, but with dental anatomy. The questions also you have to note it down along with dental anatomy. And you can also refer to Neeraj Wadhwan for the different MCQs for dental anatomy and dental histology. My personal experiences, I refer to Neeraj Wadhwan and Neeraj Wadhwan's different yearly papers 2015, 14, 13, 12, 11. It's very important. Questions do come if we solve it regularly and keep all the points in mind. See, it's not that we study it continuously. We have to give breaks. Breaks are very important. After breaks, like it may be a tea break, entertainment break, or socializing break, but after a break our mind needs break for engulfing lots of information. So if we think morning is the best time for studying, and if we think that we are studying something theory in the morning, it gets occupied in our conscious mind to a larger extent than what we are studying at the evening. It is of much more importance. So I will suggest, if you are studying the theory, please study during the morning, and please leave 1 to 2 months in your hand for revision. Revision is as much as important as your study schedule. So thank you guys. This was all for today for dental histology. I hope you will like my video. If any questions are there, do ping me up and in your email ID and WhatsApp. So thank you and good night.